Thank you uh, for letting me reconnect to some of the new INSEADers who are going through it right now. I am extremely jealous because you get to live this experience right now. And I'm looking back to my time and thinking about all the people who gave me really good advice. So, hey, listen, if 15Ds you're watching, love you, miss you.
So welcome back, everyone, to part two of our candid conversation with Siddharth. If you haven't watched the first part, please find the link to the video in the description box below. So yes, we are ready to get started.
So obviously, with healthcare, there are a ton of opportunities that people can look at, people can explore. But I'm sure the pandemic has also changed the trajectory of healthcare jobs and the kind of opportunities that you're looking at going forward. So if you could tell us a little more about whether the pandemic has opened some particular opportunities.
This is going to be a very controversial one. I can tell you that already. Um,
We
and
like
again, I'm saying this in my personal capacity. I'm not saying this as a reflection of my company, but uh, yeah, as an MBA, I found two really interesting things. Um, the first one was that hospitals or healthcare ecosystems are are facing immense financial pressures at this point of time, which for me is uh, like, which for me was like an aha moment. I was like, wait, what? We are in the middle of the biggest pandemic that we've seen in our lives, which means that the health system should be working a lot more, which they are. But at the same point of time, you're telling me that they're not making money and they're sort of at the brink of like bankruptcy and all of that, which means that systemically somebody had not thought about the business proposal. It had to be always around the value capture. And there's an interesting conundrum between value capture and value creation. Uh, and this is where preventive health comes in. So when you start seeing this, it has systemically changed over time where clinical diagnosis has given way to sort of looking at radiology and diagnostics in a whole new world. Uh, people don't people don't really trust the doctor without a report anymore, and there's a reason for that. You get sued for medical malpractices, and that has happened previously. So what that has done is it has systemically pushed up the price of access to healthcare, and that is something that we can see right now, which is the government has to give like subsidies or stimulus packages across the globe for people getting tests done or people getting some kind of treatment for COVID-19. Um, but at the same point of time, it's also created this massive disparity between the haves and have-nots, which is a gap that we need to bridge and we need to think about. I don't have the answers to that, but people who have like $150 or $200 can go and get their test done. Um, and like it's put us in a massive ethical conundrum about how do you really commercialize um, what is the Hippocratic oath for commercial companies that are working in healthcare? We give them, like, we ask the doctors to take it, but what about the companies that are really serving the people? And are they serving the people? Who are they serving? What are the needs? Health insurance is a great example. Like, how is that going to get affected next year? So if you've had COVID-19 this year, how's your insurance premium going to look next year? We don't know. And in those cases, the systems sort of, you start seeing the systems between Taiwan, you start seeing the systems from the UK to the US to Hong Kong, and there's this sort of balance that we need to find out. So in the UK, I remember that one of the principles of the NHS was that healthcare should be free at the point of care, which is and I've experienced it myself. I've gone into a hospital, I've waited for 45 minutes. Yes, that has happened. But But I got an X-ray done, and I did not even have to get my credit card out. Like I didn't have to get anything out. And that was because I was paying taxes, which kind of subsidized the system. Uh, but at the same point of time over here in the US, you have some of the best healthcare systems in the world, but I don't know if I can access them. So I don't know if my insurance covers it. So those kind of questions are things that we need to look into and rethink, which is like, how do you create value in this broader ecosystem? How do you move more towards preventive health? And a lot of companies, be it insurance, be it health providers, be it governments, be it individuals like me caring for my parents, would be like, okay, how can I look at different technology trends that will allow me to be uh, allow me to have preventive interventions, as opposed to trying to wait for somebody to fall ill and then cover the risk by taking them to a hospital. Uh, so those are things that have come top of mind. Of course, it's created a massive burnout across different systems, but at the same point of time, it has given us an opportunity to take a step back once this is over, to like once we get out of the respond um, uh, phase to the recover phase and then to the reimagine phase. There are so many things that we need to think through. So I think it's really question the status quo of where we are, where there was incremental value capture happening over a period of time, to asking the simple question: how do you create value in something that is a core need for humans, which is the benefit for their health? And we don't know the answer to that.
So, Siddharth, I think that was very thought provoking, and we could have like an entire session on the thoughts that you just put out. And you talked about, in a way, the need for, given the current circumstances, you talked about the need for business leaders, right? Um, uh, so we want to understand more about the need for business leaders, because many of our listeners will be joining their future companies as generalists. So how can they stand out in a pool of specialists?
That's a fascinating question, and I think there's a book called Range on that topic. It's about generalists in a world of specialists or something like that. Um, and I recommend you read that as well. But my personal experience has been that you're never really it's the whole concept of the T-shaped people, where you're a generalist across multiple domains, you can understand, but you can really go deep into one. And for me, that is health. So if it's commercial partnerships, I can talk about it. If it's marketing, I can talk about it. If it's product development, I can talk about it. But the depth of knowledge that I have is usually in health. The generalists are needed to connect the dots across the different specialists in these ecosystems. And I think a major part for business leaders, I really like the theme "Business as a Force for Good" at INSEAD, is to really rethink some of these frameworks where we have just like started executing on for years. Now you have to like understand where frameworks come from. Frameworks come from some assumptions, and then those assumptions at that point of time are challenged, sort of, and you sort of go back and forth. But then you are like, okay, these assumptions hold. So now we are going to sort of systemically scale these assumptions and make a framework out of it. And then like people just fall into the trap of just following frameworks blindly. And this is something that I say to anybody who listens to me, is that you should question every framework, especially the ones made by you. And the reason for that is because there's an inherent bias. Because I built this framework based on my assumption, that's why it's correct. Uh, the world needs to question the frameworks that we work in today. We need to rethink the way that value is created, the way data is captured, the way information is shared, the way we think about preventive interventions, the way we think about preventive health all up. All of these assumptions need, like all of these frameworks and assumptions need to be challenged to really, really recalibrate us for the future. Uh, Climate change is one thing where this recalibration is happening, whether people believe it, don't believe it, completely up to them, their personal choice. But there is a severe recalibration in understanding how fossil fuels versus clean energy works. We need a similar recalibration to happen in health. And when I say health, it's not just about healthcare, because healthcare implies that you're looking at somebody as a patient. Health implies that you're looking at somebody as a person. So we need to change that conversation from a patient to a person and bring in the continuum of life, as opposed to waiting for the person to fall ill and then treat them and then figure out how do we capture value and how do we make money over there. So I would rather give you $5 to stay healthy than give you $50 to fall ill. And that is something that nobody is like really thinking about in the broader sense. I mean, there are pools of people who are thinking about this, but that is where we need the recalibration to happen, and that will be done by generalists, because you have to cut across finance, you have to cut across regulation, you have to cut across like marketing and perception shift of people. You have to bring the humanities in. Like, we have such a high sort of focus on STEM and science and technology. We often forget that like one of the greatest landmark books has been written by a historian, Harari. Like, he did not study technology, but he was able to connect the dots. So we need people to come in and connect those dots and really bring to life some of those core impact or initiatives that we can have for the betterment of the society while being sustainable as a business. So the point is, I'm not saying do charity, because that's not sustainable, but you can definitely try to create net new value, but that means you have to traverse all of those fields, and that's what a generalist does well.
All right. I love the part where you said, like, in a way, like prevention is like, you brought back the phrase, like, prevention is better than cure, and how it's so important. Uh, Siddharth, we know that you have worked in India, and then you went to the UK and then the US. And you also, in one of your previous answers, you talked about how the healthcare system in the UK was quite different from, and maybe, I don't know, maybe better, because it's more accessible than in the US. Uh, uh, so, what are the cultural differences that you have seen while working in the UK and the US?
Oh wow, that's a loaded question, especially for somebody who's from INSEAD. Uh, so I don't know if it's better. It's more equitable, definitely, in the UK. Better is a question on what lens you're putting. Um, I think the difference in the work culture definitely is what you hear. The stereotypes live up to it, where in Europe people just like are, your weekend is your weekend, nobody works. People have a better work-life balance, at least in my experience. Um, and and in the US, it becomes a work-life continuum. So the balance changes to a continuum, and people sort of move into. I kind of like it in a way, because it is more autonomous. It allows you to figure out what you need to get done, how you need to get it done. Uh, the other thing is like the risk appetite is definitely different, um, especially in health. Um, I've seen this, like in the UK, to get any traction, you have a higher bar to entry, which can kind of put off some of the startups. So you kind of have to have something published, you have to have some kind of clinical research done, you need to do stuff around it, whereas uh, you can't really shroud things under the wellness and nutrition umbrella and push it into the market. Um, in the US, there has been a higher risk appetite generally for startups and for new innovations, which is why you see a few happening over here. But that also means that you really have to think through what your innovation is going to do. And the UK in that sense was slightly more more aware about the implications of technology on people. The difference that I see in the US versus the UK is US is more technology innovation, like breakthrough technology innovation. The cloud happened here. A lot of machine learning stuff happens here. Of course, it happens in Europe as well, but the focus is on breakthrough technology innovations. Whereas in the UK or Europe, it is about those applications to like how to use that technology in a way that solves for an industry. And the mindset's also similar. Like the mindset over here is like, how do I make this better? And over there is how do I use this to make something else better? And that kind of paradigm is slightly more pervasive um, across across verticalized industries versus horizontal technologies. In my personal experience, I know that's an oversimplification because the US is a massive country. It's a freaking continent. I only know about like the limited knowledge that I have on the West Coast. So New York might be a different ballgame altogether. So I can't speak for that.
Do you think this difference is because of regulations, or is it just a cultural difference in the people?
I think there's a difference because of a few things. It's about how you define success. It's about regulation for sure. It plays a massive part. Um, it's also about how do you think through a problem. When you're thinking through a problem as a technology innovation, uh, a large part of the customer journey is left out because you're trying to build the best technology solution that there is. And I have to give it to like the companies over here, the startups over here. They do build out some of the best technologies that we've seen. uh, in the UK, because there's regulation, you have to think through it, but that also forces you to think through a lot of other things, uh, which means that uh, you're slightly more robust when it comes to technological impact on the society by the time you come to your seed round. So it's a mixture of different things. It's a mixture of education. It's a mixture of like people just being more aware. I think of a few things. Um, in either case, like both countries have their benefits. Um, I think it's really important for me personally to have had both of these experiences because uh, it's uh, it's one of the key uh, things to make me a generalist again in this field. Um, but I think the US is improving. Um, and in terms of thinking through, California has passed some regulation around laws around privacy. People are talking about privacy. People are being asked to sort of testify in the Congress over here. So I think there's a definite shift that's happening around the approach, and that's good. So if you ask me the same question 5 years from now, I might not have the same answer, but the cultural differences are really like meeting somebody at INSEAD where you have a core shared value, but you might have a different approach to it. So you might have the same goal in mind, but a completely different approach. And those are the things that allow you to sort of ride this multicultural ride when you meet people, when you talk to them, but also gives you the perspective to listen because you might not know something and it might mean something completely different in a different culture. So Erin Meyer, who's one of the professors at INSEAD, has done some pretty amazing work on this around the culture map. So I definitely like don't think I'm an expert, but yeah, both have their own benefits.
Absolutely, totally agree. In fact, you talk about the different takes, different approaches, right? So the last section of our interview, by the way, we're done with the formal interview. All those questions are done. But the last section is a little more fun, where we take your approach on certain rapid fire questions. We have this
Yeah.
tradition here at Roll Call. It's a personal way of thanking our guests for their time by putting them on the spot and really digging an answer from them.
That doesn't sound like a way to thank people, but okay, I'm up for it.
Different approaches, Sid. Totally different approaches. So, but we promise you, these are easy questions, and whenever you're ready, we will fire them up.
Okay, yeah, ready.
Awesome. So, in a world where anything could happen, which healthcare issue would you solve first?
Women's health.
Perfect. One thing you wish you knew about healthcare before you made your debut?
How complicated it is.
What's the most potent advice you have got in your career?
What's the most, sorry, I missed the question. What's the most
Potent, as in
well, entrepreneurship is like driving a car at 100 miles per hour while building it.
Whoa, okay. One thing at INSEAD you never imagined you would do?
One thing in INSEAD?
Yes.
Be in a group with 4 different continents
Fantastic.
or 5 people.
Any regrets from your time at INSEAD?
Not really.
Perfect.
There's a lot of FOMO, but no regrets.
Just today, somebody told me that after INSEAD, you just get over FOMO. You no longer have FOMO once you've done INSEAD. That isn't
Yeah,
it?
absolutely. You can't have FOMO after. If you've passed through that, you can't have FOMO.
There can't be more FOMO than what you.
There can't be more FOMO.
Fair. So Sid, that's a wrap. Thank you so much, Sid, for chatting with us. We are certain that your experience and conversations will be super helpful for our viewers. Also, thank you for the active contribution that you're making in solving some of the world's most pressing problems.
Thank you. Thank you for having me, and thank you for letting me reconnect to some of the new INSEADers who are going through it right now. I am extremely jealous because you get to live this experience right now. And I'm looking back to my time and thinking about all the people who gave me really good advice. So, hey, listen, if 15Ds you're watching, love you, miss you.
Thank you everyone for joining in. We will make sure to send this video to 15Ds for sure. And we hope you like this episode. If you have any recommendations or suggestions about what we could cover next, please let us know in the comments section. And as the tradition goes, please subscribe to our channel and like and share this video with whoever you feel could benefit from this.